All right, here they come.
Welcome to the early birds. Thanks for arriving so early and spending some time with us this evening. So I will do my very best to make it worthwhile because I know you're probably busy with all your holiday stuff. So we'll give a couple of minutes for people to come in, but I'd also like to introduce you to Leona. Leona Cullen is the backbone that makes everything happen with Empowering Patients over the past 8 years. So she's my partner with this big project. And we really, really love reaching out to not just the Burnaby community, but everyone that we can help to support you in living healthy and happy lives. Leona will be posting some useful resources beyond this talk on the chat. So Leona, if you don't mind, you can just kind of highlight some key things that would be helpful and of interest to our audience.
Yes, absolutely, I can do that. So one of the things I'm going to put into the chat is our Empowering Patients page. So this is the Empowering Patients program. Like Dr. Wong said, we've done this for a few years together. So I'm going to put up our main page, and that includes all the upcoming talks. We have talks scheduled through the spring, and it also includes recordings of previous talks that we've done over the past year. So if there's any topics you're interested in and you want to check out the recordings, they're there for you. I'm also going to post the resource page. It's called Other Resources, and that's got includes all the presentations of each talk and an information sheet that you can print or email to folks. Just share the wealth with people that you know. Dr. Wong actually develops all those programs and he updates them. So that some of the topics we've done a few times before, but the information is always updated with the newest information. So we really appreciate that. I'm also going to post the Burnaby Division Looking for a Family Doctor website. We do manage the non-urgent wait list here in Burnaby. Unfortunately, there is quite a substantial wait for a family doctor, but the best way to get attached would be to go to that page, fill out the online form, and our team will reach out to you when your name comes up on the list. And there's lots of really good information to read on that page. I'm also going to post the Burnaby PCN, Primary Care Networks page, which highlights just tons of resources that have been developed by our division in partnership with community partners and with the health authority. There's social resources, resources for seniors, for youth. And one of the ones that I wanted to highlight tonight, and I'll pop that specific link into the chat, is on our community fridges. I believe there's 4 of them now in Burnaby. And the motto is just, they're free groceries, take something or leave something. So take a look at that. If you have anything spare around your house and you want to drop some food off at the fridges, that would be very much appreciated by everyone in the community. I'm also going to put up the link to our Doc Talk. So that's another health information series that we do here in Burnaby, and it's family doctors that do these presentations and share the information. Recent Doc Talks have been on blood pressure, COVID boosters. If you have questions on COVID boosters, there's information there, and foot care, why foot care is important. So check out that page. And lastly, the COVID Roundup. It's a weekly COVID specific newsletter that we do. It's very simple, very short, but it's vetted information that we put together, just gather from different newspapers and that type of thing, just to highlight what's going on in the world of COVID. And that's it. The most recent issue on that is just for December 2nd, so last Friday. A new one will come out tomorrow. So go to that issue that I post and subscribe. And if you do that tonight, then you will receive tomorrow's issue. And that's it for me, except when we finish off the webinar at the end, when we close it down, there's a short survey. It's 8 questions. And it's just asking your opinion about what you thought of the session tonight. So Dr. Wong and I really value that feedback. So that's it for me.
Oh, thank you, Leona. You can see how busy Leona is and how busy the Burnaby Division and PCN are. So do look at our website. Now, today's topic is the keys to positive change, transforming our old habits into healthy new ones, and brought to you by the Burnaby Division of Family Practice, which is a nonprofit association with all the doctors that serve the Burnaby community. So some in partly in the US, partly Vancouver, but mainly serving the Burnaby community. But everything that we're sharing, the information, the Empowering Patients program is for anyone and everyone that we can share with. You don't have to be in the Burnaby community. And I'd like you to share with, all your family and friends and the people you care about too. If there's anything that really resonates with you that would be useful for the people you care about, please share the wealth of information that we have. And again, check out the Burnaby Division website as well. I always start with just that question about what is health and what is health. So normally people think of what happens in the hospital, but family doctors, of course, work mainly in the community. So we talk about all the importance of long-term, longitudinal community care, especially in the doctor's offices, but also in a variety of other ways that primary healthcare providers serve our community, and helping manage with chronic conditions and also preventive health and keeping you healthy. But that includes everything that you don't always see all the time: care in the community, proactive preventive care, and our daily habits that we're going to be talking about today. And again, who provides most of your healthcare? It's not your family doctor, it's really you. And we're here to support you. So a big part of the Empowering Patients program is giving you the information you need and giving you tips on being able to access information from your healthcare providers, be that your nurse practitioner or your family doctor, or any other specialist or other healthcare provider that you encounter with. So we have a variety of talks, but the main message is real healthcare is self-care. You're in charge, but we're here to support you with both knowledge and giving you access to the healthcare system. And a reminder that the best predictor of your future health are the habits you practice today. So we'll be giving you some tips on healthy habits and tips on how to make positive changes according to what's important to you. The whole Empowering Patients program is kind of centered on 4 foundations of looking after ourselves. So I call it the 4 foundations of self-care. Number 1 is what you eat, what you put into your body, and also thinking about the unhealthy things we put into our body, like excessive alcohol or recreational drugs or cigarettes. Number 2 is what you do, physical activity balanced by appropriate rest. Number 3 is how you feel, emotional well-being. And finally, the 4th foundation, how we connect, our importance of our relationships. So we've had talks, and we have videos on each of these topics, and a variety of other topics on how to connect with healthcare providers, how to communicate, medical ethics, particular chronic conditions like high blood pressure and diabetes, I talked from last month. And there'll be new topics coming up in the new year on respiratory disease like asthma, chronic bronchitis. So the 4 foundations of self-care: what you eat, what you do, how you feel, and how you connect. So today we're talking about change, how to create change in your own life. But I'd like you to reflect on how you feel about change in general. So just a few little highlights of all the changes that all of us have gone through, just part of the population and as a healthcare provider and as patients, just the bewildering number of changes we've had to cope with throughout the whole pandemic. When we started off, this mysterious new infection, COVID-19, the public health restrictions, what's allowed and what's not allowed. And then we were hoping for the vaccine. We got the vaccines, and some people got some side effects from the vaccines. Waiting on finding out when we can get booster shots, when we didn't even know at the beginning we had to get booster shots. And then what kind of masks to wear. And on top of that, all the other things happening in the world, the war in Ukraine, the shortage of family doctors, rising interest rates, recession, and then the things that come up all the time in our lives at different stages, the unpredictable changes with accidents or new illnesses, and the inevitable aging, the changes in our body all the time. So to a lot of us, changes can be quite overwhelming and causes lots of stress. So kind of reflect on how you feel about change. Because most of us like that balance between things being predictable and stable and things being interesting and new. That's why we like watching Netflix and flick through Facebook and social media to see what's new. But at the same time, we like things to be predictable. And things are really upended every aspect of our lives during the pandemic. So it has been a really stressful time for everyone. I don't think anyone would like to go through this again, and we're not quite finished yet. So if you didn't have any variety and challenge and change in your life, we'd be pretty bored. But when we have too much stress, like most of us have had in the past 2 years, then we become kind of burnt out, really stressed and anxious and not enjoying life quite as much. So I've come up with a word that you can use too. So when I'm surprised, again, by some unexpected change, the first thing that comes to my mind is a 4-letter F word, and it's not what you think, it's flux. So flux means constant change, because that's what reality is. Reality is constant change. Everything is changing. Everything in your world, in your community, and every cell in your body is changing. We sometimes think of ourselves as really stable and unchanging until we look in the mirror and then think back on what we used to feel like and look like. But every cell in your body is being regenerated and replaced. You're not the same person physically, mentally, or emotionally that you were just a few moments, and definitely not a week or several years ago. So we might say that we don't like change, but reality is change. That's what life is all about. So we have to embrace and accept change because we are a part of that change. Most of us don't like being in lineups, especially at Christmas time when we got things to do and places to go. So we might at times say, I hate being in a lineup, or I hate lineups and crowds, and not realizing that you're actually part of the crowd. Or when you're stuck in a line of traffic and saying how much I hate traffic, and then realizing, well, I'm actually part of the traffic too. So this change that causes us lots of stress, we're actually part of the change too. So we all have to accept the reality of change. We don't have to like it all the time, but we have to accept it. But how we cope with change and how we adapt is with the growth mindset, knowing that you and I each have the capacity to learn, adapt, grow, and positively change our thoughts, beliefs, feelings, and our behavior. And that's where healthy new habits come in. Because a lot of things that we think of as bad habits or old habits may have been good habits at one point, but they may have morphed and changed, or the conditions of your life may have changed so that they just don't work anymore. Habits are really important and good, because once we get into a good routine, then we don't have to think about exactly how to cook our breakfast and dinner, or how to shop, or how to start riding a bike again. So we get into routines that make things easy, makes it easy for you to find your way back home at the end of a day at school or work or other activities without having to think about every detail and pull out a GPS or a map. But when things change, like when we move to another community or traffic patterns change, we have to change our pattern of behavior as well. So sometimes we just life and you outgrow your habits of behavior, but habits are not necessarily bad. And we each, with its growth mindset, can be agents of positive change in our own lives and in our world. And I want to share with you that today I want to reveal your superpower. When I was a kid, when we first saw Superman, one of my friends, Dan, said, what if we actually had superpowers our whole life and we didn't realize it because we never used them? Well, actually, you do have a superpower that I have too, that you didn't realize, or you may not have fully realized that you did have. And that's called metacognition. And it's not something new from the metaverse or Facebook. Metacognition is the ability to recognize your own thoughts, beliefs, and emotions, and to transform them. So we have the ability to recognize thoughts that pop up that are produced by our brains. In my talk on emotional well-being, we talked about our brain as thought factories. So we come up with lots of thoughts, negative, positive, anxious, depressed, angry thoughts. And with metacognition, another portion of our brain is able to recognize those thoughts, recognize that some of them may not be that accurate, and know that we can actually choose from a different way of thinking about things. So that's different from being caught up in our thoughts of negativity or anger or self-criticism, and actually recognizing there's another way of looking at things. And I'm going to challenge you today to kind of look at some of your old beliefs that might have served you well or made sense when you were a kid or another stage of your life, but no longer serve you well because they prevent you from achieving your potential today and in the future. And metacognition is also your ability to recognize an emotional state without getting caught up and overwhelmed by it. So recognizing when you're feeling kind of the physical symptoms of anger, but knowing that you can step out of it and look at the situation, not necessarily act on that anger, and not let your thoughts be run away by the feelings of anger. So that's a superpower that we can develop with time. And I wish it was something that they taught in school, or that we supported parents in early childhood to coach their kids on being able to label their emotions, recognize their thoughts, but not get overly identified with them, and recognize that we can transform them through a lot of techniques that we covered in emotional well-being. Another useful way of thinking about our brains from neuroscience is that we have two hemispheres to our brains, the left hemisphere and the right hemisphere. So we do know that when people have strokes, they could be paralyzed on one side of the stroke is on the left side of their brain that controls the right side of their body. Well, there was a neurophysiologist named Jill Bolte Taylor who about 2 decades ago had a stroke that wiped out the left side of her brain, but her right brain remained active. And she discovered that that critical part of our brain that has our life story, that judges things as right and wrong and judges other people as others, as different from ourselves, that left brain was offline, and she started seeing the connections and the wholeness and the sense of peace. So she kind of discovered through experience that the right side of the brain has that ability to kind of look at you as not just an individual separate from everyone else, but connected to all humanity, to the people in your life, but all life on earth as well. So it's useful to kind of get out of that narrow left brain, right and wrong type of thinking, where a lot of our negative thoughts and judgments come from, and to slip into the right side of the brain. So a big part of metacognition is recognizing that we have two perspectives in our brain, but most of life, like school, work, and most relationships are getting stuck on the critical left side of the brain. So a lot of the habits that are kind of established in the left hemisphere of your brain can be transformed with that connected, loving, unconditional perspective of the right brain that we can nurture through that practice of mindfulness that I talked about in my emotional well-being talk. Oh, and by the way, if you haven't been for that talk, all the recent talks for the past year are actually on the emotional or on the Empowering Patients website, on the Burnaby Division website. So you can watch reruns if you run out of Hallmark Christmas movies to watch or shows on Netflix this holiday. So I'm going to cover 4 keys to positive change. Number 1 is to choose wisely. So know what your big goal is, not just the small behavior habit that you're going to start. So what's your big goal? What do you want to achieve? And why do you want to achieve it? Is it connected with your deepest values? Number 2 is planning well, kind of creating a specific plan and anticipating challenges ahead of time. Number 3 is to understand how habits form. So I'm going to go over some really practical advice from recent books, Atomic Habits, and another useful book on habit formation, the ABCs of habits. And then 4, really visualizing success, using your whole brain and imagery to increase your likelihood of success and to really nail down those new habits you want to start. So like Indiana Jones and the Holy Grail, choose wisely. So what is your goal and why? So I'd like you to reflect on the big picture. kind of think of what are your most important values. So what really guides you and informs you, and what really resonates with you, and what reflects your truest self, kind of that right cerebral hemisphere, that big connected self that thinks about your whole life and your whole connection with all of humanity and nature and the universe. So here's a big list of values. And just remember, these slides you can access through the Burnaby Division website, our Empowering Patients page under other resources. So all the slides we're using are available there. So when you have time, it'd be good to kind of reflect on these different values that people have. And here's another way of looking at it, like your most important values. One of my most important is love. So I actually think that the whole point of life is actually to be loved, to accept love, and to learn how to love and share that with others, not just with your own family, but with everyone that you can connect with. And not just people, but animals, nature, and your community. So that's one of my most important values is love. And of course, family is a really important part of life, because that's how we really first learn to love, sometimes in a conditional way. And we know that we're all imperfect, so we all kind of love in imperfect ways. But there's also unconditional love that we can nurture through mindfulness and meditation, using more of that right cerebral hemisphere. It might be communicating. It might be patience and tolerance. It might be benevolence and doing well for others. For others, it might be just hard work and earning lots of money. But when you dig deeper, you should kind of question, why do you have those values? And do they still resonate with what's most important to you and your truest self? So kind of reflect on what kind of values are most important to you. Authenticity, compassion, your relationships, being kind, gratitude or justice, your connection with nature, excitement and adventure, or achievement, or generosity, or courage. So these are all great values. I think of life and health as the invitation to achieve your positive potential. And actually, that's the whole goal of life. Life is kind of a gift we have. And it's also discovering what your gift is to the world. So I know that each of us has a positive potential. And I think it's our duty to discover that potential and to live it, but also to help others achieve their potential. So that's my big role in my life with family, but particularly with patients in my community. I want to support others to achieve their positive potential for health and happiness in life. So I think of health is not the absence of disease or just treating disease, but really that dynamic balance of the most important areas in your life and achieving your potential within each sphere. So even in the face of challenges that every life has, and it's the experience of that unique purpose that we talked about, and where you have a sense of meaning. So about 20 years ago, I came up with this symbol that just reminds me on a day-to-day and weekly basis to think about my positive potential and how I can foster that in other people. And right in the center is always what's your calling? What are you really here for? What really resonates? What's your bliss? So these are the kind of the important areas of your life you can think about, that balance between rest and play and work, between your social life and your family life, your physical life and the life of your mind, mental well-being, your environment and your internal environment, your emotions, finances, just getting by, and your spiritual well-being. So these spheres we kind of balance throughout the week and throughout the day. Most people don't think about all the important areas of their life. Sometimes different stages of our life can take hold. Like we can get really lost with work, and a lot of companies and businesses will take as much as an employee will give them. And that can take away from your time for yourself, rest and play, and time with your family as well. Or you could have a really stressful relationship or situation at home, and then the rest of your life kind of gets neglected. So I always find it useful to kind of review these things every day. I had a system of just thinking about from Monday to Friday to thinking about each of the spheres, like the social aspect of my life and my family life on a Monday. Tuesday, kind of reflect on my goals and physical well-being and mental stimulation. And on a Wednesday, I think about my work and home environment, but also my emotional well-being. And then a Thursday, I'll think about, financial goals, but at the same time as spiritual goals. Then the Friday, think about work, rest, and play. And then the weekend, reflecting on what's my calling. What have I learned this week? And am I moving closer to my goals of achieving my potential? So think about these important areas of your life: the social, the spiritual, your family life, emotional well-being, your intellectual well-being, financial well-being, your work or school, recreational, environmental, and physical, these important spheres of your life. And remember that true health is a dynamic, harmonious balance of all these spheres and achieving your potential in each of them. And so each of you has your own personal goals in each area. I just want to kind of share this as kind of some examples and what my particular goals are in these areas. And they don't have to be the same as yours. But I'd like you to kind of reflect, maybe during the holidays or on this weekend. Maybe you could pull up these slides with a good friend or a loved one and just sit down and think about what your goals are in each of these areas. So in your social sphere, I like to think of having a sense of belonging and a place in society, in my community, how I relate to other people, that I have a supportive network of friends and family, that I enjoy intimate relationships. And for physical well-being, these are my goals: to enjoy a well-balanced diet and maintain a healthy body weight, to exercise regularly, and that includes strength training, flexibility, balance, alignment, and cardiovascular fitness. Being free of harmful substances or habits such as smoking or drug abuse or alcoholism, or relying on food for comfort, and not to suffer from poorly managed chronic conditions. So you could still have something like diabetes or high blood pressure, but we can learn to manage them well with the support of your healthcare providers. So some environmental goals would be to feel comfortable in my own home, to have a workplace that has good lighting, good air quality, noise control, where I feel safe, and not feeling crowded in my home or work or environment or the commute to and from work, and just feeling safe in your world. So each of us has different challenges at different stages of life, and having a healthy home environment. And then some ideas for financial well-being is having an adequate, predictable income, having debt that is manageable, having realistic plans for achieving certain financial goals like owning a home or living where you'd like to live, and plans for retirement as we get older, and to have adequate savings and insurance in case of emergencies. So sometimes we have to turn to other experts in this field besides healthcare providers, like accountants or financial planners, to help us with that. And some work goals might be finding just that right balance with work, where the challenge of your work is matched by your personal resources. But when the challenge is too high, like we talked about, too much change, we can get really stressed and then burnt out. And then you're having work that is consistent with your ethical values. And I'm really blessed to be able to work as a physician, where I can listen empathically to my patients, listen to what their goals are, share my knowledge and connect them to what they need and support them in achieving their personal health goals. To enjoy good relationship with coworkers. So I do a lot at our office to foster joy in our work and a sense of camaraderie and connection. And to feel a sense of control at work, knowing your actions have predictable positive effects. So I know not everyone has that in their work, but that would be a good goal for all businesses and workplaces to try to achieve. And then what are your family goals? Mine are to spend enough time with my family and to have a good relationship with every one of the members of my family and have a good intimate relationship with my wife, and to derive a lot of satisfaction and fulfillment from family life. And some of my mind goals are to have good problem solving skills, be able to express my thoughts clearly, being able to use my own intellectual strength optimally, and have a way of improving on my weaknesses and things I need to do better at, and learning more things, being a lifelong learner, part of that growth mindset. And I'm constantly trying to expand my point of view. So not seeing that my beliefs have to be the same throughout my life. So often we identify too much with a particular point of view, knowing that, our brains and experience and our knowledge is limited. And to kind of try to see things from others' points of view, and often we can broaden our perspective and give us more flexibility of thinking. And emotional goals would be to have mutually loving relationships, appreciating the views and feelings of others, that's empathy, and being aware of your own emotional states, having good insight in how I'm feeling and thinking right now. So that's a big part of metacognition, is recognizing those thoughts and feelings as they're coming up before they take control. And then that second part of metacognition is being able to manage your emotions. And some goals with rest and play is getting enough sleep. So that's a challenge for many of us, but particularly for family physicians who are up late at night. I think I have another 3 hours of administrative work to do before I go to bed after this webinar. But getting some breaks throughout the day. So I actually try to coach my coworkers, physicians and staff, to take mindful breaks throughout the day, so that's refreshed and giving their best to every patient. And to have some satisfying non-work interests outside, some hobbies and other interests outside of work. And nurturing a sense of creativity, so artistic things as well. So I like writing, and I like playing and writing music as well. And I like drawing. So those things are totally different from my work life that I find rejuvenating. And then your spiritual well-being. So my particular goals is to stick with my sense of purpose in my life, my trust in the universe, being guided by my own moral compass and code of ethics, and to live in accordance with my values. When it comes to your calling, that center of that big mandala, so I think of our calling as that intersection between your talents, what you do best, your passion, what you love to do, the needs of the world, and your values, of course. So where those three things intersect and align with your values, that is your purpose. It could be the purpose at this stage of your life, or your life's purpose, which can change over time. Because often when our kids are young, our big focus and calling is to be the best parent we can be, and to nurture these young ones to have a strong sense of self and emotional intelligence and love and compassion for other people. So again, my little mandala on achieving your positive potential. It's a balance in looking at your values and goals in each of the important areas of your life. And if we do have an idea of a particular value or goal, it's good to kind of ask backwards of, why do I have that goal? So the 5 whys actually comes from organizations that look at the root cause when mistakes occur. We use it in healthcare. So if there's been a mistake, like the patient was given the wrong medication, we ask at different levels, why was the patient given the wrong medication? Well, it was administered by the nurse. But we're not going to blame the nurse, because the nurse gave that medication a particular way because of the way the doctor wrote the order in the old-fashioned way in handwriting, like on a prescription pad or in doctor's orders written in the hospital chart. And why was that? Why was the order written incorrectly or misinterpreted? It could have been because the doctor was using abbreviations that could easily be confused, or using a 0.5 and putting in 0.5 milligrams where it was interpreted as 5 milligrams because the decimal was not noted. So that could easily be confused in giving the wrong dose of a medication. And then why did that happen is because we didn't have a system that prevents us from using particular types of confusing terminology in our orders or in using decimal points that can cause some confusion. So now, for an example, a hospital throughout, actually most of our hospitals in BC and Canada, we have some standards of what things are not acceptable in writing out prescriptions to avoid confusion. So if we dig in deeper, we can look at what's the obvious cause, but actually continue to ask, why did this happen? We can get to the root cause. So how does this apply to your goals? Well, you could turn around and uncover the deeper motivations behind your particular goal. So if your goal is to exercise more, it has to really resonate with your deeper values. So it might be you want to exercise more because you want to get in really good shape and look like the cover of Men's Health magazine with a six-pack, because you want to impress a particular person of the opposite gender. So you kind of think of, is that a worthwhile goal, or should I be exercising because I want to be healthy and to be fit? So kind of looking at the underlying reasons for your goals is really useful to ask yourself, is this an important goal to me, and does it resonate with my most important values? Asking why is really important. So you might discover that your initial goal is not aligned with your deepest values. So you might think that, oh, one of my goals is to make so much money in a particular time or to buy a particular car. And then if you look at the deepest value, well, why do you want to buy a particular car? And it might be just to impress other people, and you recognize that this is a gas guzzler, it's not going to be good for the environment. And like all things, everything will change, and eventually that car will get old and rusty and will not be of any value to you. So kind of digging deeper to make sure you don't get stuck in goals that are not aligned with your deepest core values. So that first step was choosing wisely, choosing the right goal based on your deepest values. And taking a big look, knowing that it's really hard to focus on many different goals at different times. So kind of break it down, look at the important areas of your life, decide what's going to be your focus today or tomorrow. So the next key is planning well, coming up with a specific plan and anticipating challenges. So we want to design kind of achievable, concrete steps or routines, like new habits, which will be little stepwise approaches towards the positive change towards your positive goal. So rather than suddenly saying that I'm going to run a marathon, I want to run a marathon, so I'm going to go out and run 40 kilometers tomorrow. That wouldn't be very realistic when you haven't been walking too much. So setting smaller achievable goals, and then having a plan how you'll gradually work up to increasing your mileage. So once you plan out what the stepwise routines are, then you can kind of create little goals in the form of habits. So you outline a plan and then schedule the stepwise routines. So our habits are kind of unconscious or automatic behavior, and it's just the way that we learn. So once we've learned a skill, like riding a bike or learning how to walk when you're a child, it becomes second nature. And some of those basic things are always really useful, like riding a bike and not falling down. But sometimes other habits, like a particular way that we go home or a particular routine that we do in relating to other people, sometimes it becomes an automatic way of behaving that doesn't work anymore because the conditions have changed. So this applies to habits of behavior, like exercise, or eating, or smoking, or drinking, but it also applies to habits of thought. So that's really important when we have a tendency to be overly critical, or we tend to greet or relate to family members or friends in a particular way, or coworkers in a different way. So we can actually kind of reflect on how we relate to other people and kind of evaluate what might be a better way to communicate and connect. Because all of our brains are kind of focused on the negative. And our brains need to hear 5 positive things for every negative thing. So if as a parent, all I say to my daughter, or half of what I say to my daughter, is criticism or demands or asking to clean up, she's going to kind of avoid talking to me because it sounds like everything I say is coming out negative. I need to kind of balance out and kind of express my appreciation for the things that she does do well, and my appreciation and love for her at the same time. So kind of giving 5 positives for at least any requests or any criticisms. So learning to relate in different ways is another useful habit. So you can choose that for one of your habits as well. And habits matter because what you do each day has a cumulative effect on every aspect of your life. And our habits define who we are. So we want to consciously foster positive habits to become better versions of ourselves. So you might have heard of the idea or theory of multiple universes, that if you made a different decision or married a different person or chose a different career or course of study, you would have ended up in a totally different parallel universe where you may be happier or not so happier with a different family. So what would your life be like, and who would you be if you made different choices and fostered different habits? So today could be a turning point in creating an alternate universe or a parallel universe that you can create a better version for yourself by kind of looking really carefully at your values and choosing one goal that you would like to start in the next week. So I'd like you to kind of think about one area of your life that you'd like to improve and try to come up with some goal that you'd like to achieve, and that kind of apply these upcoming techniques for those goals. So think about your future self and recognize how we can change over time. So if you think backwards over time, you could be pretty amazed at how much you've changed and grown and how much you've learned. But a lot of us kind of estimate how much we can change in the future, and the things that are important to us now may not be that important in the future. As I mentioned, we kind of estimate how we might change in the future, but knowing that you have this ability of metacognition and that I'm giving you some great tools for positive change, you'll recognize if you start a healthy new habit next week, that how much different your life will be in just a year. So really, your present self creates your future self. And the choices you do today and act upon daily will create your future. And again, act as the person you wish to become. So if your goal is to be a writer, then act like a writer and get down and do the writing. If you can think of yourself as an amateur athlete rather than just someone that just wants to exercise. And from James Clear in Atomic Habits, so I'm borrowing some ideas from him in the upcoming slides. James Clear said that every positive action is a vote for the person you want to become in the future. So begin with your end in mind. So think about at the end of your life, in your 70s or 80s or older, how would you like to be remembered? So of course, this is Steve Rogers, Captain America, the younger and older version. So looking back at your life, imagine yourself in the distant future. How would you like to be remembered? And so kind of what have you done with your life and how have you related to other people? And then thinking back from that vantage of the end of your life, what did your actions say about you? And what will be the legacy of your activities and your relationships? So when you're choosing your goal that you'll start in the next week, we have these SMARTest goals. You may have heard of SMART goals, but in Burnaby, we of course use the SMARTest goals. It's just an acronym to tell us what key things we should come out with so that we have a good, really concrete goal of what we want to do. So the goal should be specific. So if your goal is to exercise, what will you do and where are you going to do it? So it might be that you may want to start working out at the gym. So what are you exactly going to do and where are you going to do it? Or if your goal might be just to start walking around the neighborhood. M is for measurable. So how long are you going to be working out at the gym, or how far are you going to be walking? A is achievable. So it has to be realistic and doable, not running 20 kilometers tomorrow if you haven't been walking at all. So you might say initially, I'd like to walk just 10 minutes tomorrow, rain or shine. R is relevant, it has to be important to you and your health. And again, aligned with your bigger goals, your ultimate goals, and with your values as well. T is for time. So when are you going to start this activity and when are you going to finish? And what time of the day you're going to do it? And what days will you do it? And then E is for evaluating. So looking back after that first week, asking yourself, how did I do? And what did I learn from trying out this new activity, this new habit? E is also for enjoyable, so you have to make it fun. And I'll give you some tips on that as well. And S is stepping forward after you've achieved that initial goal of walking 10 minutes every other day. At the end of that week, what do you want to do next? Do you want to make that a 15-minute walk every day? Or T is for together. Who will you work with? Are you going to invite a neighbor or friend to go for a walk with you? And who do you want to share your success with? So the smartest goals just give us a reminder of what are those key things we should think about if we're starting to start a new activity or a new healthy way of eating, like eating more vegetables, or a new way of learning more things or relating to other people. So this big part is kind of the nuts and bolts and how to make those, how to really solidify habits and reinforce them. So understanding how habits are formed. When we're not really focused on a particular task, we fall into this default mode network. So it's kind of our brain on autopilot. So it's when we're kind of driving home and our minds are wandering and we just get home all the time. So it's how our brains work and how our brains learn. James Clear wrote about this established habit loop in Atomic Habits. So it's a book that's available in our public libraries, of course on Amazon too, or chapters. So he outlined the 4 parts of the habit loop. Number 1 is the cue. Number 2 is craving. 3 is the response to the behavior. And 4 is the reward. So cue, craving, response, reward. And I'll go through each of these. So cue is the context. That kind of is the trigger for doing the behavior. So an example is, a trigger could be being bored, being on the elevator. That's kind of the cue for you to kind of whip out your cell phone and check your social media or check for your email for messages. A craving is the desire that comes with that cue. And it could be that desire for junk food or some chocolate or smoking or a taste of alcohol. So the thing that is the desire, and that could be triggered by watching TV and seeing that McDonald's or Wendy's commercial. The response is the behavior. So that behavior could be grabbing a bag of chips because we're kind of triggered by the cue on the TV commercial and the desire to have some snack, or we're triggered by the cue of being idle and then starting to crave nicotine, and the response is lighting up a cigarette. And the reward is the immediate positive feedback. So that could be satisfying our hunger or craving for a snack food when we're watching TV, or the boredom and restlessness get satisfied by our curiosity by opening our phones and checking out social media, or that satisfaction of the nicotine craving by the nicotine itself from the cigarette. So that's the immediate positive feedback that's kind of feeding some of our bad habits. So again, cue, the context or trigger, craving, the desire, response, the behavior, good or bad, and the reward, the immediate positive feedback. So knowing that, if you want to create a good habit to replace the bad one, or just start a good healthy behavior, you want to make your cue really obvious. An example is if you want to start eating healthier or starting to exercise, a fruit bowl on top of the TV is a nice cue to remind you to have a little snack between commercials. Or leaving your workout clothes and your runners just in the front door is your cue that when I come home from work, I'm going to slip on my shoes and go for a nice walk, rain or shine. with a bright yellow umbrella. So making a cue and setting it up so it's easy to remind you that you can avoid it. The next is craving. So make what you're going to do really attractive. So you compare something you want to do with something you need to do. So you want to go for a walk, but you can make it more fun by inviting your best friend to go with you so that you'll make it enjoyable and it's not such a chore. So hooking the two together. And I have a routine of going to the pool every morning. And one of the things that makes it attractive is having people that I know and swim with all the time, so that you kind of have pool friends or gym friends that you're looking forward to see. And then when you think about the response, you want to make it easy. That's why we chose kind of simple goals to start with, like going for a short walk for 10 minutes every other day, rather than going for a big run that might make it really difficult. So make it easy. So if you want to drink more water, you might keep a pitcher of water and a glass by your desk at all times to remind you. And also keeping your fridge stocked up with fresh fruit. So it's really easy to eat healthier or to grab something that's going to make you feel good. So just make it really easy so there's fewer barriers. And then make it a satisfying reward. So reward that behavior. And one way is actually charting it down. So we do know that if you have these little charts and writing down when you exercise, that gives you a dopamine surge and gives you a sense of accomplishment. Or even giving yourself a high five in your imagination. But if you do it with a friend, giving each other a high five is a great way of rewarding yourself right away. Make it satisfying. So really thinking about all four stages is really important. So again, you need a cue that wants to be obvious to remind you to do that activity. You want to make it attractive to create a positive craving. You want to make that new behavior really easy to do. And you also want to make it really satisfying. So really focusing on these four things. So it takes a little bit of planning, but they really reinforce and make it more likely that it'll be an established habit. So it's not just doing an activity for 60 days makes it an established habit, but you can really establish things much quicker by attending to the cue, the craving, the response, and the reward. So a bit of planning is a lot of reinforcement. BJ Fogg wrote another great book about the ABCs of habit formation. It's called Tiny Habits. He also has a website, tinyhabits.com, that kind of gives you kind of the gist of the book, but it's a really useful book with a really simple but effective approach to forming a new habit. So the ABCs by BJ Fogg are anchor, behavior, and celebration. So the anchor is kind of the trigger. So what you're going to connect the new habit with. And B is the behavior you want to do. You want to make it simple and easy. And tiny, that's why tiny habits. And C is the celebration that we'll talk about as well. So the first step is to make that behavior really tiny and easy to do. So an example he says is, I'm just going to floss one tooth. So when you make it that easy, then it's really low barrier and easy to do. And chances are you're going to end up flossing more than one tooth when you get started. So just getting started is sometimes a big barrier. If you make it really simple, then it's less likely you're going to procrastinate. So make that behavior really tiny because you're going to build on it after 10 days. And number two, hook that behavior, that tiny habit, to an anchor. So something else you're going to do in the same place, same time. So it might be a routine you're already doing, like brushing your teeth. So I'm going to floss one tooth right after I brush my teeth before bedtime. And then the third step with tiny habits is to celebrate immediately. And he has some funny ideas. So give yourself a thumbs up or up, clap for yourself when no one's around, and just think, I nailed it, and way to go. So saying those silly things to yourself or doing those actions, even if no one else hears you, actually gives you a really boost of dopamine. And that's immediate celebration gives you a positive feeling that reinforces that habit. So that's your immediate reward. So he creates little recipes of the ABCs. So after I brush my teeth at night, I will floss one tooth and I'll celebrate by saying, nicely done. So those three parts. So an anchor when you brush your teeth at night. B is the behavior, a really simple, tiny habit of flossing one tooth. And then the C is celebration, giving yourself a high five. Nicely done. So the ABCs. So check it out in Tiny Habits, but you can look at the website and it kind of reinforces this same little process of thinking of one small change just to get you started. And then you can easily establish this habit in less than 10 days. And then you can go on like we did with Smartest Habits and looking at what I want to do next. What am I going to tackle next? Carl Jung said, until you make the unconscious conscious, it will direct you and you will call it fate. So kind of uncovering our habits and then consciously getting out of this autopilot mode. Because we adopted a lot of unquestioned and assumptions and core beliefs about ourselves in childhood and growing up that we never question. It becomes a deep buried part of our left hemisphere that creates the story of our relationships, our family relationships, and how we frame our narrative or our story about our past, and really shapes how we respond to other people and ourselves in the future. So we all have, every one of us has some unquestioned assumptions and core beliefs about how the world works and who we are as individuals and in our relationships. And I know from experience with myself and other people, my patients, that we all adopt limiting beliefs that prevent us from living our fullest lives and achieving our potential. One is I have to be perfect to be loved. So it's a lot of people have that feeling because often we're rewarded when we do things well. And as children, we might misinterpret that as needing to be perfect to be loved. And that kind of brings out a lot of perfectionism and self-judgment and feeling like we don't deserve to be loved. And a lot of people with really difficult early life experiences start seeing life as unfair or thinking that they can't trust anyone because they were betrayed or mistreated earlier in life. And that limits our relationships going forward. Or the belief that I'm not good enough or don't deserve success, happiness, or love. Or the feeling of being powerless because of events in the past when you were smaller and more vulnerable. So it's helpful to kind of question those core beliefs that keep bubbling up and then really ask, how are they working for you? Do they bring you closer or further to others, society, and your goals? And how can you challenge them and balance that with more accurate beliefs about how your world is today and who you really want to be? And do your core beliefs really foster positive feelings and connection with other people and positive actions, such as kindness, creativity, and generosity? So these are some ideas for core beliefs you may want to adopt or adjust. But these are my core beliefs that I really feel that I'm part of a greater whole, not just one separate individual. And I'm a part of a family and a member of this Burnaby community. And I'm part of this nation, and that I have a unique potential, just as every one of you. And that unique potential that we all have is our gift to the world, not just for ourselves. And that we each can make a positive difference with our actions, big ones, but also small things that we can do every day for other people. And that I am continually learning and growing, and I can adapt to change. So change is not a bad word, and neither is flux. So it's all about engaging with life and coping with change, and how we are transformed in a positive way to be an agent of positive change. Because the reality, as I said, is that change is the nature of all things, and it's our very nature. And we have to accept what we cannot change, but accept responsibility to change what we can. So every one of us can be an agent of positive change. By being dynamically responsive to change, we can seek out the positive potential of every moment of every day. So I enlist you to be an agent of positive change using your superpower of metacognition and what you've learned about your own values, setting your own goals, and creating healthy new habits. So those 4 keys again were: number 1, choose the right goal based on your deepest personal values. So it takes a bit of reflection. Create a specific plan with the smartest goals: specific, measurable, achievable, relevant, time-bound, enjoyable. What's your next step? And together, who you're going to bring on board. Translate those goals into habits with the ABCs of habit formation. Anchor it to something you're already doing. Make it a tiny behavior that you can achieve and celebrate right away, giving yourself a high five and remind yourself you nailed it. And then remembering James Clear 4 parts of establishing a habit: getting rid of bad habits and making good habits easier to do. And the 4th key that we'll address now is visualizing success. So this is actually using kind of the deeper unconscious parts of your brain to really nail things home. So Gandhi said, be the change you wish to see. But I'm reminding you to see the change you wish to be, to really visualize that. So I'd like to take a little exercise with you. So I hope you've visualized a goal that you'd like to achieve, or kind of have some idea of what you'd like to achieve and what we've discussed already. So I'd like you to take a big breath. You can close your eyes if you want to, if you feel more comfortable. And just visualize yourself in the next day. What are you seeing and feeling around you? How does your body feel? And think about the new habit that you wanted to start. And think about that cue or the anchor behavior that's going to trigger you to do that activity, and see that coming up. And really see and feel yourself in that situation. And then see yourself performing that behavior, that new behavior that you want to achieve, your new healthy habit. So you're seeing the trigger, you're doing the activity. And remember to give yourself that positive reinforcement, that high five, that nailed it feeling, that positive feeling that you've done it. So visualizing yourself like this ahead of time, kind of give yourself your own post-visualization suggestion. So when that cue pops up, you remember to do the behavior. Remember the positive feeling that's going to follow that behavior. It's a little mental rehearsal. Now I'd like you to close your eyes if you'd like. And I'd like to visualize, see yourself in the near future, maybe just a few months from now. And then kind of reflecting back, having achieved, this is your future self, and this desired behavior that you've been planning for is now routine behavior. So you may be doing that exercise and activity every day as part of a normal routine. And think about how positive and good you feel about this new improved feeling of well-being. Having that sense of control over this aspect of your life. And being really keen and confident that you can choose incremental goals, another step to move towards your positive potential. And that you can apply the same technique of thinking about your values and goals in important areas of your life, connected with your deepest values, that you can choose new goals and build upon established routines and fine-tune your life and adapt to whatever life brings to you. And that you know that you can apply the same strategy and technique as you gain in confidence over every area of your life. So again, we can pre-experience ourselves planning our steps of what we want to do using those smartest goals, and kind of pre-experience or energize ourselves with that feeling of accomplishment at the end, and seeing ourselves having achieved our goal. All the sensations and feelings of accomplishment. And then finally, from your future self, just reflect with gratitude to your present self for taking each necessary step along the way, celebrating with every step, adapting to the unexpected, to challenges that came up, and being able to alter or fine-tune our goals. And learning a new way of doing and being and connecting with life. Okay, if your eyes are closed, you can open them again. So we've learned a lot in the past 20 years about how our brains work. And there's a new science, actually it's at least 20 or 30 years, called about neuroplasticity. That's the ability of our brains to rewire itself. So neurons that fire together, wire together. So when we get stuck in habits, we might think that they seem to be kind of hardwired. We know that with effort and repetition, we can transform our own minds. And that's a big part of metacognition, that superpower that I revealed to you at the beginning of this talk. Your brain, no matter how old or young you are, has an amazing ability to learn and adapt. And with deliberate practice, we can learn new ways of thinking and feeling, creating new habits of thought, feeling, and being. So we can transform how we respond to the same situation and new situation. We can change how we feel about things, and we can act in more positive, constructive ways. And it was Donald Hip, a Canadian neuropsychologist, who framed the term neurons that wire together, fire together. So this is how we learn things, by repetition and connection and association. And this is how we learn new habits and reinforce them as well. And when we make old habits that we wish to extinguish more difficult to do, more challenging to do, using those tips from Atomic Habits from James Clear, and then reinforcing positive habits with the tips that we learned from BJ Fogg, over time we kind of create a new way of being and establishing this neuroplasticity, the neurons that fire together, wire together. So we create a new neural pathway that almost feels hardwired, so we don't have to work so hard to achieve the same goal. This is how we can adapt to our changing world, no matter what comes up in the next year, the next 5 or 10 years. Another principle of neuroplasticity is the principle that what we focus on, we magnify. So if we focus on the positive and possibility and growth and change and the growth mindset, we will expand what we're able to do. Whereas if we focus on the past with self-judgment or limiting core beliefs, we kind of make that our reality as well. So think about that and choose what you will focus on. So making the impossible possible. So this is called the principle of attention density, or concentrated attention solidifies your new habits of thought, feeling, and intention. So doing it mindfully and with focus. We can deliberately evolve into our positive potentials. Again, living our calling, where what we do best, what we love to do, and the needs of the world and our values intersect. That's our calling. And I believe there's a positive potential to be realized each and every day. We just need to see, feel, and act. Recognize the needs of others, feel their feelings, and to act. And as I said, I believe that each of us has a unique potential in life, and it's our duty to realize our potential and to help others achieve theirs. And we can all be agents of positive change in our own lives, in our community, and in the world. And another quote from Gandhi, happiness is when what you think, what you say, and what you do are in harmony. So living life deliberately. So together, let's be the change we wish to see. And of course, let's see the change we wish to be. So I'm going to stop sharing And I always leave plenty of time for questions, either about what I've talked about today or anything else that's on your mind. Anything about COVID or flu shots or anything that would be of, you think might be of interest to people in the audience. So I'm going to stop sharing.
Hello.
Hi, Leona.
Hi. Actually, so far, no questions. There's a few people who are wanting to know where the resources are. A few people want to know where they can have access to the presentation. Because the website is up to date, so tonight's presentation and the information key point documents are already on the website. So I've posted those in the chat a couple of times. So it's good. People are keen. So hopefully they're going to share the info, share the love. But so far, I don't see any questions. There was one that I think went directly to you, Dr. Wong. So I think you're going to deal with that one.
Okay, let's see if I can
Oh,
find it.
Somebody raised their hand. There you go, Mabina. I've unmuted you if you want to share your question with Dr. Wong.
Thank you so much. First of all, hi to everyone. You both look wonderful and festive. So as I'm sitting here in my sweatpants, you look wonderful.
Well, you don't know what's going on down here.
Fair. I've had those types of meetings as well. Well, the upper half looks wonderful.
Thank you.
So I didn't really initially have a question, but now that there aren't questions, I'm going to try my best to ask one. Please forgive me while I try to put my thoughts together. It's around the visualization piece. So I know there's lots of research around how beneficial visualization is. Is it partially because, okay, so if we have, let's say, deep-rooted negative beliefs about ourselves or even the world or the world, would you say part of the reason visualization is beneficial is that if we do it repeatedly, it's like a faster way to hack the neuroplasticity and rewire it quicker? Because to change some of that deep-rooted stuff it's not as easy. It takes time. I hope my question makes sense.
Oh, yeah, that makes sense. Now, when I use the word visualization, but there's maybe 10% of people that actually can't see things visually in their imagination, but they can feel things and sense things. So the idea, what we focus on, we magnify. So it's like mental rehearsal and engaging the whole of our brain. So if you visualize yourself being successful, being at ease, being kind to yourself, adopting new beliefs that work better for you, to seeing yourself in that future state, you want to imagine how you feel physically, like how relaxed your body is. And what do you hear, like the positive self-talk? And what do you feel? And that might be the emotions of feeling, loved for just who you are and having that love for yourself. What does that feel like? So imagining that reinforces what's going on subconsciously and other parts of the brain. And subconscious isn't anything mysterious. It's just those parts of our mental processes that we're not aware of at the moment. Like subconsciously, we're controlling our breathing. We can make that conscious if we want, and then suddenly it's conscious. So just kind of engaging all parts of your brain, and that strengthens the neural connections, and it's mental rehearsal, and it reinforces those neural connections that connect you to that feeling of feeling loved, seeing the world without judgment, seeing ourselves without judgment. What's really helpful is you might imagine some figure like Mahatma Gandhi, or you might imagine Christ, or a spiritual figure, or a person in your life where you feel in their presence. You can imagine their presence and them smiling on you, surrounding you with unconditional love, telling you that you're worthwhile and that you have value just as you are. So just surrounding yourself, that imagery, what it feels like to be loved unconditionally, what it feels like to be good enough, can sometimes combat some of that negative self-talk, which is reinforced on the left side of the brain. So that kind of visualization with your imagination is imagining the feelings, the sensations, what it feels like to be in that state. And then you can pretty well practice. So another habit that we can establish, this is a little bit more complex, is that we all get triggered by things. Like we might have a familiar argument with someone at work, and it kind of triggers a thought and a judgment. But we can kind of use these tiny habits to kind of the same technique. So when that feeling comes up of self-criticism or self-judgment or judging someone else, that becomes that kind of trigger for when you're going to expand your consciousness. Just at this moment, when I'm feeling small or angry, I'm going to suddenly become aware of unconditional love, that part of myself, that person or presence that I can bring to mind, so that I can bring that right brain, loving, connected perspective with compassion for the other person over myself. So we kind of create new habits of thought in the same way. It's not just eating better or not smoking or starting to exercise. These are habits of thought, so we can respond to triggers of everyday life with a new positive perspective. And the more we do it, the more automatic it becomes, and that becomes our new self that we've created.
Okay, as you were speaking, I got the answer that I think I was seeking, but I also became present to what my question was. Is it okay if I just add like one thing around this
Sure.
whole topic? I think my question was more, I actually have no issues with visualization in general. I have a very easy time, even when I read books, etc. But where the issue is for me is when I visualize, I struggle seeing myself in those more positive states and feeling. But you then answered it by, I guess my follow-up question is, would it be a good place to start by choosing people like Christ, Buddha, Muhammad, all these people who were around who, you know, did a lot of good for us in that light? Because when I start visualization, it feels fake because I don't believe a lot of those things that I want to be feeling, like unconditional love, all that. So makes sense, right?
Yeah, so whatever kind of induces those feelings that you desire, that you choose to have. So it is nice. So we can think of those figures from the past, or you can actually think of some people that kind of embody it, like the Dalai Lama, or recently deceased Thich Nhat Hanh, who kind of embodied that unconditional love. And you know, if you were in their presence, then you would not be judged. And they can teach us how not to judge ourselves.
Okay, thank you so much. That answers it. It's something I've struggled with. So I'm really glad I asked this question, and thank you both.
You're
Awesome.
welcome, Mabina. Good questions.
Yes, very good questions. I've got
Made
Albert
me
here.
think.
I've got Albert here that would like to ask you a question as well.
Go ahead, Albert.
Hi, Dr. Wang. Yeah, I've been reading your articles in the Burnaby now for many years. I really enjoy your, your
Thank
writing.
you.
And yeah, actually, I kept a couple of things that I like. Yeah, I've been given that. Yeah, quite, very helpful. And also the programs are very in line with my Buddhist perspective of life. And I really like to contribute and volunteer if you have any situation. That's one thing. Second one is do you have any like mindfulness and meditation program or something? I'm sure you are a very good teacher. I prefer to be a mindfulness meditation the practice, because I'm a vipassana meditator. I'm a student of the S.N. Goenka from India. So if there's any mindfulness, the meditation program that you're providing, I know you have a lot of techniques. Yeah, I know you're very familiar with many meditation methods. Yeah. And to me, visualizations, I'm not very good at it. Doing that. It has some merits, but I prefer the something like mindfulness. Seeing the things as the true natures are. So something like that. If you have a mindfulness reduction program or something like a Dr. Zen Kabat-Zinn, in the state, like they are giving this kind of mindfulness reduction program, something like this. Do you have this kind of program?
We don't have any program as part of the Empowering Patients. We do have things that kind of overlap with what you're talking about. We have so we have the Be Well program. It's just for people to have. So if any people have a Burnaby family physician that's a member of the Burnaby division, your family doctor can refer you to the Be Well program, where you can have health coaches that can guide you in establishing healthy habits and lifestyle. And we also have the PCN counseling program that is for mental health counseling for people that can't afford psychologists. So if you have a Burnaby family physician, they can refer you to counseling if you need it. But we don't actually have any formal courses for mindfulness. There is a CBT skills program, which is a combination of cognitive behavioral therapy and mindfulness. So it's actually a 6-part, 1-hour program that a family physician anywhere in BC can refer their patients. It's an online program that patients could be referred if they have mild, moderate anxiety or depression. So that's the CBT skills course that integrates some mindfulness. But we don't have any Jon Kabat-Zinn mindfulness-based stress reduction courses here.
Oh, I see. I like that program. I watch it at the YouTube. So I wish we Canadians have some one version like this. So okay. So the program you mentioned just now, where can I get the site? You mentioned a bunch. Yeah. Can I get a link or something?
Well, for the Be Well program, you need your family doctor who's a Burnaby family doctor to refer you, because it's part of the Burnaby Primary Care Network.
It's called Be Well. Be Well program, right? It is called.
Yeah.
Be
So
Well.
the Be Well, Be Well program.
Okay. And the other one is.
And then the PCN counselors, that's if a patient with a Burnaby family doctor doesn't have any coverage for counseling and they might have moderate depression or anxiety, we have some really excellent counselors that they can be referred to. And that's mainly for Burnaby based doctors and patients.
Okay.
And then the CBT skills, any patient can actually ask a physician, if their family physician anywhere in BC, you can be referred to this web-based group, cognitive behavioral skills. So and a large part of it is mindfulness, because you always need mindfulness to balance with cognitive therapy, so we don't judge our errors in thought. Like catastrophic thinking is common when we have anxiety, and it makes anxiety worse, thinking about the worst case scenario. Or all or nothing thinking is common, and that makes depression worse, thinking about all the worst, or all or nothing, or self-judgment. But if you just recognize the errors in our thinking, we start judging ourselves. So mindfulness is a kind perspective so that we can recognize those thoughts, not identify with them.
Yeah.
Yeah.
That's
So,
what I mentioned today. Yeah. Recognize them. Yeah. Thank you, doctor.
Oh, you're welcome.
Great.
We'll take a look at the video for emotional well-being, because I talk about CBT and mindfulness. And I'll expand it for the next one, because with my own patients, I try to teach them mindfulness, integrating with cognitive therapy, recognizing our thinking errors. But mindfulness you could practice by sitting and meditating. So I learned mindfulness that way, Vipassana meditation. But there's also microdosing mindfulness, which I teach my colleagues at the office, so that when they go to the washroom, that's their trigger to see the sign I left in the washroom wall that says, may you be happy, healthy, peaceful, and safe. That's the metta unconditional love meditation. So when they go there and they're kind of rushed and doing their business, they can kind of reflect and kind of focus on that unconditional love towards themselves and their patients and colleagues as well. So I try to do little exercises to encourage people to do little 1 or 2 minute exercises and being mindful throughout the day. And then kind of creating the interruptions of the day as triggers, like a meditation chime to center and think about what am I thinking, doing, and feeling. So kind of create that so you maintain that mindful, kind, unconditional attitude and loving attitude towards people and yourself throughout the day. I find that's most effective of staying on track. So if I haven't updated emotional well-being, the next one, well, I'll include kind of the techniques that I teach my patients when I teach mindfulness.
Our next emotional well-being talk is actually January 12th. So I've just put the registration link into the chat. So if you're interested in participating in that one, you can just register right from that link. Dr. Wong, I have Craig is asking if you have quick key points to generally overcoming inertia.
I guess you missed the beginning, Craig. So it was a big motivational talk to tell you about your superpower, your power to change your brain. So metacognition. And what the other thing that was supposed to get you really excited was knowing that you are an agent of positive change. That even if you think you're sitting still, you're still changing. That you're getting a little bit older, you're getting a little bit stuck, and the chair you're sitting in might end up moving anyway, so you're going to have to move. So life is constant change, even our own bodies. So even if we are resisting change, just out of comfort, we can move out of that change knowing that we need to adapt. So it was kind of a little pep talk at the beginning. But one is to make the change you want to do really tiny, really easy, and make sure it's connected to something you really, really want. So you have a lot of motivation. And we talked about some clues and making that little thing you want to do really, really easy, like a tiny step, and making sure there's a cue to remind you to do it and to make it really attractive and to reward yourself right after. So that'll kind of keep you moving a little bit more downhill so it's easier to do. And then once you get confident with making that small little change, like an easy thing I do is like one little habit I do is I have a chin-up bar in my master bedroom washroom. So every time I have to go to the washroom, after I go to the washroom, because I might be in a rush, I will do 10 chin-ups and 10 leg raises. So once you start doing that, it becomes a habit. Then you can do 20 or 30 or 50, but starting really easy. So BJ Fogg said, when I go to the washroom, I will do one little push-up from his knees. And before you know it, because it's so easy, so he does a one push-up and he gives himself a high five and says, nailed it, and does a touchdown dance. So you can make it really simple, so easy with something linked to something you're going to do anyway. And then you'll gradually gain confidence and increase that to 10 push-ups. So I hope that helps. And if you need more, then I'm happy to coach you along and encourage you to overcome inertia.
That's great. And so I've got Barb who is wanting to ask you a question. So there you go, Barb.
So I wrote it on the chat. So I wanted to know if there's any accommodations or adaptations to make this presentation a little bit more geared towards adolescents, like specifically teenagers, because the audience is, in this particular case, it's more adults. And so I was wondering, because there is especially for those suffering with mild anxiety.
You're gonna have to get me thinking about our next presentation, and we'll have a teenage version.
Yeah, I think that there would be, especially since we're facing, well, at least for me as a parent, I'm facing with that particular issue, and more I'm seeing it throughout my friends, so I thought, well, what a great presentation this would be if it was catered to that audience who is currently being impacted so much. And, I thought that was really, really good. So,
Yeah.
uh,
So the next talk is on emotional well-being. So I'll look at it to see how we can make, but of course with teenagers, they kind of like really, really short presentations. So
and exactly, their attention
yeah,
span is so small. So I thought
yeah.
even if
So I'm gonna
it can
have
be
to
divided
get together
three,
with my daughter and do some TikToks on,
there you go.
on anxiety. Yeah, I'll
Yeah,
put my thinking cap on, but I think this type of presentation that obviously goes over 20 minutes won't work for
no,
those
it
teenagers.
wouldn't.
No.
But the topics in itself, breaking it down, I think it would be tremendously beneficial, especially the one where you're discussing about how to change bad habit into a good habit. That's that caught my attention. I was like, oh, but then my second question is, have you heard of EMDR? And how would this be connected to something like this?
EMDR is a technique, kind of trademark, eye movement desensitization technique. So it's actually used, psychologists are trained to do it. It's used a lot to kind of connect to the subconscious, things that can't be verbalized. So used a lot in PTSD. So it would be used more by psychologists that are trained in that technique and
Okay.
for particular things. And it should only be practiced by for those conditions that the psychologist or practitioner has expertise in, such
So
as PTSD or anxiety.
so visualization wouldn't work, or wouldn't it be tied to this same type of technique?
No, EMDR is kind of different from visualization. So it's accessing kind of subconscious areas of our brain or nonverbal areas of our brain to that technique. And visualization is something that we can all do just using our imagination. So when patients come in with problems, try to listen to their problems, but also to encourage them to visualize their goal, which is going to be the first step to the solution of their problem.
Right.
So if the individual has a lot of stress in their life, we like to imagine them, what's the opposite of stress? So I'll talk a little bit about Roget and his thesaurus. Roget created a thesaurus of antonyms and synonyms because he was feeling really depressed. And he wanted to come up with words that would make him feel better. So the opposite of depression or isolation were the losses of some close friends. So we try to encourage people that are kind of stuck in anxiety or depression to think of what's their goal, what's the opposite? Is it feeling more at ease, more connected, more confident? And to visualize that as if it's a reality, and then kind of sit down, what do we need to do to get to that destination?
Thank you very much, Doctor, for the information.
You're welcome, Barb. Thanks for the suggestion. So I don't think there's enough time to do a whole bunch of TikToks because I don't even know how to do that. But my daughter's an expert.
Thank you.
Thank
That's
you.
great. Awesome. Well, I think you covered it. That's all the questions that we have. We had some nice thoughts from Dalton. Really enjoyed the talk, and thanked you for sharing your wisdom. Susan Delonzo said that her and Rob really enjoyed the talk. Very motivating. So yeah, it was a good one for sure.
Oh, thank you. Thanks for your positive feedback, everyone. And thanks, Leona, for being our great support in the bedrock of our Empowering Patients program.
My pleasure.
And
My pleasure.
yeah,
So
yeah.
just
And
like
again,
I've said in the chat, is the materials from tonight are already on our website, so you can see the presentation, you can see the key points document, and tomorrow morning by noon tomorrow, the recording of tonight will be up, so you can share it with your friends, and be sure to register for our upcoming talks.
Yeah, and best of luck with your new healthy habits in the next couple of days.
Yeah, exactly. Exactly right. And don't forget to fill out the short survey when we close down the webinar. The information is really helpful for us.
Okay, so wishing you all a healthy and happy holiday season and a
Yes.
healthy
Happy
new year.
holidays. Merry Christmas. Take care,
Merry
everybody.
Christmas.